We'll start with sweeping strokes around the whole head. You can do opening sequence stroke from this position as well. So with flat thumbs and thinner eminences, from starting just below the ears, we can sweep on the lateral sides of the neck and then finish with the fingers just over the clavicle. Lateral neck over the clavicles towards sternum. Now, sweeping strokes over the whole face. Starting at, you can do pinching. You can pinch like you were pinching the chin of the client. So very gently, just sweep from the jaw area towards the ears. 3 times. Then you can do it again just below the client's lip. 3 times. And above the client's lip. 3 times. Sweeping with flat thumbs from the cheek area towards the front of the ears. 3 times. And then from the forehead area towards the front of the ears. 3 times. With flat thumbs. After that, follow up with opening sequence again and clear that straight away to cervical nodes 3 times. Now, again, starting at the jaw, we will now put our flat fingers medially, right? So somewhere around the midline on both sides, and we'll be performing stationary circles, so directing inferiorly and laterally the stroke. So we're actually making sad face. So inferiorly, actively stroking inferiorly and laterally, and let the skin spring back. 5 to 8 strokes, and move laterally on the jaw. So we're making sad face with our stroke. 5 to 8 strokes, and we move again laterally. So now we're around the masseter muscle. So sweeping actively, inferiorly and laterally, making sad face. Then with index finger or with the middle finger, whichever is more comfortable, start medially over the upper lip and do small stationary circles, again directed inferiorly and laterally, making sad face. 5 to 8 strokes, go laterally. 5 to 8 strokes. Then around the corners of client's lip, making sad face. Five to 8 strokes. Then sweeping from the nose area, so starting between their eyes and with small stationary strokes, again the same direction, gently sweeping from that area. Then we move inferiorly and laterally over the nostrils. However, just be careful not to obstruct the client's breathing. Then, starting on the cheeks, right laterally to client's nostrils, small stationary circles with your fingers. And we'll go around client's cheekbones. So from medial to lateral side. You can repeat the sweeping stroke over the cheekbones 3 times. And if you want, you can also repeat this opening sequence, particularly if we are draining the area that needs it the most. Now, small stationary circles on the very delicate area just below client's eyes. So very gently now I'll use my index finger. So starting medially, very gently, stationary strokes. This is very good, particularly after some surgeries where they are bruised or swollen around the eyes area, or for beauty, as a beauty treatment as well, if they have puffy area below their eyes. So we go around that delicate area. And also we can include the temples in this case, so small stationary circles. Now you can add more fingers, so like with my 3 fingers, I'm performing stationary circles on their temples. Clearing the forehead area, place your fingers, so it very similarly to the jaw, we will place our fingers medially first and gently circling inferiorly and laterally. 5 to 8 circles, and we'll move laterally. Then we go back medially, but a little bit more superiorly. Again, circling the area. And then laterally. I can go a little bit more laterally as well. Then coming back to the midline, right on the border of client's hairline, the same circles, and moving laterally. And laterally again. Now, I can go back and drain the area that needs it the most. If this is tooth problem, swollen tooth gums, I can go and clear it again. If this is sinus problem, maxillary sinuses, or just behind the eyes, then I'll focus more on this area. So depending on where the problem is, I can then go back and repeat the strokes on that area. Otherwise, I will finish the sequence with the same strokes as we started. So pinching their chin, we'll sweep 3 times towards the ears. Then below the lip, 3 times. And above the lip, 3 times. Then from the cheeks, flat thumbs. Three times. And from the forehead area towards the ears, 3 times. Now I'll perform stationary circles just in front of the client's ears. Five to 8 times. And I'll finish off with opening sequence. So I can actually even include front of the ears and then follow on the neck and hooking it towards the sternum. So sides in front of the ears, lateral neck over the clavicles towards sternum. Five to 8 times.